Hello. Just waiting for Dave to come on.
Hey,
Hey, there we go.
you again.
Hello. It's so nice to see you.
Yeah. Um, so let's give people some time and thanks for getting everything set up and ready to go.
Yeah. Can you hear me okay?
Yeah, I hear you perfectly.
Perfect.
Perfect. Hey, everybody. Hey, JJ. I like that painting on the wall. How is that made?
It's
Is that like a
newspaper.
map? What is it?
It's newspaper. Like
Okay,
all
nice.
these different newspaper clippings. Kind of folded. Yeah. I like yours. That's really pretty.
Thanks. I like colorful
I was
paintings.
gonna say I like the colors.
Yeah.
That's really cool.
All right. So let's give people a little more time. So today we are going to be talking a little bit about Whitman-Walker Health's research team. And so once we have more people in the room, we'll get started, introduce ourselves, and we'll do a little Q&A with Lynsay here. Lynsay, is this your first time doing live?
It is. It
Nice.
is. You're a professional though.
I try to be as much as I can. Hey everybody.
Hello.
All right, so we'll get started. So again, today I'm here with Lizzie from Whitman-Walker's Community Health, or sorry, Whitman-Walker Research Team. I'm with Community Health Team. My name is David Wilson. My pronouns are he, him, his, and my title with Whitman-Walker is social media influencer. So I work with the Community Health Team to do outreach via social media platforms. Those include Instagram, Facebook, Twitter. So that's why you see us here producing a lot of content for you all. So hello, everybody. So during the last few months, we at the Community Health Department, we have expanded our outreach efforts. And so, as I mentioned, we're on Instagram, Twitter, as well as Facebook. So we've stretched across these platforms, so that we can cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions, i.e. research. Our series of outreach sessions that we focus on during the current pandemic, obviously, we're experiencing COVID-19 right now. And so we want to help you manage your health, both sexual, personal, and mental health during this time. So our team, Community Health, is always here to work with you. We're here to support you and educate you. So again, our conversation today will be with our research team, and we kind of want to get a little information from them about what they're doing during COVID-19. So, Lynsay, thank you again for joining us. Can you tell us a little bit about you?
So, my name is Lynsay MacLaren, pronouns she, her, hers. I am a PA, so a physician assistant at Whitman-Walker. I've been there since 2010. I was mostly doing clinical work for the first 6 years, and then about in 2016, I joined the research department.
Nice. Nice. That's a good amount of time. So it's like 10 years now.
Yeah,
Wow.
November will be my 10th anniversary. How crazy is that?
Well, congratulations on your 10-year anniversary. That's amazing. So Lizzie, can you tell us a little bit about the research department at Whitman-Walker? What do you
Yes. Sorry. So Whitman-Walker has been conducting research for a long time. We started doing research in 1987. So those very first
That's the
HIV.
year I was born.
Yeah, nice. So for as long as Dave's been alive, we've been doing research. It makes it sound even longer, right? Um, and I mean, the first HIV medications, we were involved in those studies. So we've kind of had our hand in some way in basically all the HIV medication research, probably all of the hepatitis C medication research. That's like all the drugs that are on the market today. We kind of were involved to some capacity. But we not only do pharmaceutical industry research, so like those drug trials, we also do federally funded studies. And by federally funded, I mean NIH, meaning National Institute of Health, meaning, where Dr. Fauci works. So Dr.
Yeah.
Fauci's very famous right now. He's always been famous in my heart, but now everybody else gets to experience Dr. Fauci. So he's the head of the NIH division that does HIV trials as well as other infectious disease stuff. So we get funding from that. We have this huge ongoing study called the Multi-Center AIDS Cohort Study. They call it MAX. We call it SHARE for some reason. But that study, again, has been going on for 30 years, where these men who are positive and who are negative come in and get different biological data, behavioral data. They fill out tons of surveys, and they're just kind of tracking HIV over time, comparing those that are positive with those that are negative, just seeing kind of what HIV does. So that's, I mean, the people that have been in, that some of the people in that study have been in the study as long as I've been alive. So it's really, really impressive. We also had our hand in basically all the major PrEP studies. So the original PrEP study we were part of the big Discover trial, SHIP, which was a CDC study looking at PrEP once it was first rolling out. So we have our hands in a lot of stuff. We were also the first federally qualified health center, FQHC, that's just the type of clinic Whitman-Walker is, but we were the first FQHC to be given, to be a site for ACTG, which is AIDS Clinical Trials Group. And so ACTG, also started in 1987, is the world's largest and longest running HIV clinical trials network. And so we were the first community site to be a part of that, which is really, so we have a long history of research at Whitman-Walker.
Yeah. So fun fact, actually, I was introduced to Whitman-Walker through the PrEP study. So I joined that study 6-7 years ago.
Nice.
And I've actually been on PrEP since then. And it's funny because I'm working here now. And so, that's how good the research team is, right? You just never know where that's going to take you. So that's just a fun fact.
Very cool.
So, yeah, I also want to add, like, if you have any questions, feel free to drop them in the comment box. We can address those to the research team if you put them there. So feel free to chime in, our viewers. So, Lynsay, like, with COVID-19 going on, how has that impacted the research that we have going on? Like, has it impacted it?
Oh, definitely. So, I mean, like the rest of the world, we had to figure out what we were going to do. So, mid-March is when the clinic decided that it was no longer safe to have the doors open, and we closed to most in-person type of care. Right? We have the respiratory clinic that's seeing possible COVID cases, but no other clinical care was going on, which also meant that it wasn't really safe to have research participants come in. So we had to figure out how to keep people involved, how to keep people safe on studies in this new world that we were living in. We wanted them to stay connected, so we were calling them, emailing, any way that we can stay connected, just to give them updates. We had to ship their medications because they couldn't come into the clinic to get them. In some cases, we did have people do blood work for safety labs at outside facilities. We had to pause enrollment for all of our studies, and some of the studies are just completely on hold for now until we figure out how to get going. So the research department, just like the rest of Whitman-Walker, sees advancing prevention and treatment for COVID as a health equity issue, which speaks directly to our mission. And we just really feel it's critically important to bring these opportunities to communities. So we really want to figure out how best research can help people in this time by staying connected, by staying on meds, by, staying
Yeah,
as sane as we all can.
exactly. So yeah, no, you're right. Like everyone's experienced some sort of impact by the pandemic. But I am curious, with the pandemic going on and, you all or us doing a lot of research, um, is Whitman-Walker involved in any COVID-19 studies at the moment?
Yeah, so of course, research is going to be a key tool to fighting this pandemic. And we're trying to find all the opportunities we can to get involved and to really make sure our community that we serve is part of the science and part of whatever is found that helps treat, that helps prevent this disease. So we want to be on the front lines as much as possible. So most of the studies that were ongoing, like I said, we had to figure out how to keep them going, but then also they added on surveys and questionnaires. So they were seeing how people were doing in this pandemic, how it was impacting them. But really interesting too is some of the PrEP type studies also added questions on how does this affect PrEP? Do you think HIV prevention is important right now? Do you not? Like, how do you rate it in the world?
Interesting. I actually participated in one of those. I
Oh,
got a questionnaire and I completed it because it was interesting. It was like, do you plan to continue your regimen? What do you think about that? And I mean, those are definitely relevant questions because I've thought about them. I'm like, I'm trapped in the house basically. Did I
exactly.
continue to take my PrEP, And so, yeah, it's good to know that we're involved in a lot of those studies.
I mean, it was just this real world event that everyone was thrown into, and we couldn't plan. I mean, there was no research contingencies for if pandemic happens. I mean, and research is very, very structured, right? Like this happens, then this happens, then this. So to be thrown this, and then for us to have to respond, but also for the patients to have to respond,
Yeah.
it was quite a wrench that was thrown. So, that's kind of what we have going on right now. Also, since we're part of that group, that ACTG group, so AIDS Clinical Trial Group, that network that has been having studies go on for so many years, it's really interesting that these networks are now utilized to deploy these studies, these COVID studies, because these need to be big studies so that we get good answers. They need to have an established network of people that knows how to do these intense research studies. So instead of doing HIV studies, there's a shift to do COVID studies along with the HIV studies. So I thought that's just a really cool use of the resources that we have and how can we serve even more in this time. So we hope to participate in some outpatient treatment trials. So a lot of the treatment trials you're hearing about on the news are all inpatient. So there was just one about a steroid out of London that has really good results. It's a cheap drug. It's been around forever, but that was in sick people in the hospital. So
Right.
we want to be a part of the studies that prevent people from going into the hospital. Also, if we could be involved in vaccine studies, that would be great. Those are a bit trickier to implement, but hopefully we can kind of partner with other organizations. So just as there's ACTG network, there's also HIV vaccine networks. And hopefully we can kind of collaborate with those or get our own vaccine studies, because that would be really cool as well.
Gotcha. Are there any other reasons, it would be good to participate in the outpatient trial? Like,
Yeah, so right now, as you know, there's no available treatment for people with COVID earlier in the disease. So that remdesivir, that's again hospitalized sick patients. The one that just came out, that's hospitalized sick patients. But what can we do? What kind of treatments are necessary earlier in the illness to help recovery? So about 15% of people with that get COVID will go on to be hospitalized and maybe even have other even worse outcomes than being hospitalized.
right.
And these people sometimes only have very mild symptoms, and then about 10 days later, they get worse. COVID does this weird thing that we don't understand why people are fine, and then sometimes they're not fine. So we need to get people in that part where they're still healthy, they're still able to be at home,
Gotcha.
take care of themselves, so that we can prevent them from needing to ever even go into the hospital.
Gotcha. All right. And so maybe you can tell us a little bit about why, diversity is important Obviously, like it could include like, different things like whether or not, lifestyle things. But why is diversity important in research?
Yeah, so we know that for many reasons, certain populations have and continue to be underrepresented in research. We know that these same groups are the ones that have poorer health outcomes and less likely to be able to access certain programs and services that keep them from being healthy, staying healthy. So research as a field needs to prioritize learning about the needs of these populations, why they're not coming into research, why they're important to having research, so we can start to solve these problems. So it's clear that research has failed some populations, and we need to figure out how to get those populations in, because these studies that are going on will directly benefit those same populations.
Mhm.
We need to make it a tool to help people, tool to protect them, but also to get them involved in the process of research.
Gotcha. All right, well, that's good. Do you have any other information you want to share?
We pinned down at the bottom there, if you're interested in about research. Of course, like I said, most of the studies are paused right now, but we can get you on a list that if and when research studies are available, we can reach out to you. Keep an eye on our webpage. You can give us a call, but that's going to have our up-to-date studies, and hopefully you'll see more studies listed in the future, especially COVID studies, but also don't forget about HIV studies. We even might do some hepatitis B studies. We have more studies looking at trans folk, trying to figure out the specific needs of that community that's so unrepresented, so left out in a lot of research, to really get everyone involved.
Yeah, I have one question that wasn't necessarily on the plan, but what generally triggers a study? Is it, yeah. Is that a good question?
Yeah, I mean, it can be, it's I think a huge process. It was really interesting to see how some of these COVID studies, because research studies for ACTG can take months, if not a year, for it to go through the whole process. So the protocol has to be written. Institutional review boards, those are the boards that make sure the study is going to be ran well, that it's going to be beneficial to people, that it protects the studies. They become involved. We have community advisory boards, as you know. So those are community members that are in the communities that this research is going to recruit from, that tell us the study is this sucks, or this needs to be added, this needs to be changed. And
And
so
love that part of it.
yeah, no, it's great. And HIV is really interesting in that. Why CABs exist is because HIV and the advocacy that was developed back in the early stages of that pandemic. It just really gave the scientists insight on like what voices need to be heard. Gotcha. Because sometimes they do tend to live in their ivory tower. So a lot of people there's so many steps involved. The labs have to get involved of what labs are going to be drawn, where they're going to be sent. And so somebody has an idea, and other people need to think that idea is something that needs to be studied. And then they have to figure out how to study it safely, get the money to do it, which is always probably the biggest hurdle.
Sense. I guess most people, or at least for me, when I think about research, I always just think about from a potential like drug, like a new drug that's coming out. But there's research studies that have nothing to do with it. Could be behavioral practices. It could be not always just about medication. It can literally be about physical practices that a particular population may experience, and to understand those behaviors a little bit more.
And we're really starting to do more of those studies at Whitman-Walker. Just to try to identify other research areas that have been underexplored.
Yeah. Well, I can't wait to see more of the work that you have coming. I know, the pandemic threw some things off, but I know Whitman-Walker is always working on building new relationships and getting more involved in several different studies. So I'm looking forward to what you all come up with. And hopefully those will be some that come across the community advisory board I am on.
Yes.
And so I'll be able to give my feedback.
Definitely. We love to hear it.
Yeah. Thank you for being here today.
Of course.
So for more information, you can, as Lynsay mentioned, you can visit Whitman-Walker Impact.org or call us at 202-207-2510. Again, we want to thank everybody for joining us and staying tuned. Be sure to follow us on Instagram, Facebook, and Twitter. I almost said TikTok, but we're not there yet. At Whitman-Walker is where you can find us. And we will have the most up-to-date information there, and be there. Check us out at those platforms for more information and more content. And lastly, we have a new Instagram page at Real Talk DC. It's for our youth team for Whitman-Walker. So if you're interested in that, be sure to follow at Real Talk DC _. Thank you all for being here. Thank you again, Lynsay, for giving us information about our research team. We appreciate you and all the work that you do. And we'll see you soon.
Cool. That was good to see you. Thank you.
Bye, everybody. Bye.